enlargement in cervical department has name intumescentia cervicalis. In cervical department, it's larger than in thoracic department. And in lumbar and sacral department, second enlargement, intumescentia lumbosacralis. What do you think? Why in cervical and in lumbar department we have enlargements? Why? What do you think? Because this department take place in movements of extremities. Cervical department, it corresponds to, it innervates, supply muscles of upper extremity. Lumbar and sacral department supplies muscles of lower extremity. That is why in cervical and in lumbar department, two enlargements. Cervical and lumbar sacral. Lower part or caudal part of spinal cord has conical shape, and this place has name conus medullaris. Conus medullaris. Medular cone. Conus medullaris. And from this conus medullaris start filum terminale. Terminal tip, filum terminale, that is continuation of meninges of the spinal cord, pia major, soft meninges, pia major, continues from conical conus medullaris like filum terminale, and it's attached at the level of second coccygeal vertebra. But spinal cord finished in adults at the level of lumbar to lower body of lumbar to vertebra. Look here. That is the vertebral column. And you remember that vertebral column consists of how many cervical? 7, thoracic 12, lumbar 5, and sacral 5 sacral vertebrae fused in one bone, and 3, 4 coccygeal vertebrae also fused in one bone, os coccyx. And here it is fifth, fourth, third, and that is second lumbar vertebra. And here it is at the level of lower body of second lumbar vertebra. Here it is level where spinal cord is finished. Below only filum terminale. Here it is continuation of pia major. That is why sometimes necessary to perform function of vertebral canal, canalis vertebralis. Why we need to do this manipulation? Why? To receive cerebral spinal fluid. Sometimes necessary to receive cerebral spinal fluid, or sometimes necessary to insert medicine, for example, in time of anesthesia, epidural anesthesia, necessary to insert into the spinal canal, into vertebral canal. And we perform this manipulation, function of vertebral canal between spinal processes of third and fourth, or sometime between fourth and fifth lumbar vertebrae. Why? Because if we insert needle in this place, impossible to destroy spinal cord, because spinal cord is absent on this level. Okay? Okay. In childhood, level of spinal cord in newborn at the level of third lumbar vertebra. In adults, lower body of second lumbar vertebra. Now, from spinal cord start roots of spinal nerves. if we cut spinal cord, we will see this picture. That is anterior surface, here it is posterior. And on anterior surface of spinal cord, we can see deep fissure, fissura, median anterior. It is necessary to draw. This diagram not necessary to draw, but it is external and internal structure of spinal cord. It is necessary to know. And next time you will draw, maybe I give you small test to draw diagram of spinal cord, external and internal structure. On anterior surface, we have number 1, fissure, fissura, mediana, anterior. Fissura, mediana, anterior fissure, fissura, mediana. And posteriorly, not so deep groove, sulcus medianus posterior. Anteriorly, fissura, fissure, fissura. Posteriorly, groove, sulcus medianus posterior. Next. It is roots of spinal nerves. That is anterior root, radix anterior, anterior root, and posterior root, radix posterior. Roots of spinal nerves. Anterior and posterior root of spinal nerves. And posterior root has enlargement, and name of this enlargement, ganglion spinalis, spinal ganglion. It is number 3, that is anterior, number 4, posterior, number 5, spinal ganglion, ganglion spinalis, spinal ganglion. And these roots join together and form spinal nerve, trunk of spinal nerve, truncus nervis spinalis, trunk of spinal nerve, truncus nervis spinalis. Place where anterior root leave spinal cord, number 6, here it is, this place. Place where anterior root leave spinal cord has name anterior lateral groove, sulcus anterolaterales. Sulcus anterolaterales. Sulcus anterolaterales. Anterior lateral groove, sulcus anterolaterales. And place where posterior root path has name posterior lateral groove, sulcus posterolaterales. Sulcus posterolaterales, number 7. Sulcus posterolaterales. Sulcus posterolaterales. And last moment, here it is small groove, here and here. And name of this groove, number H, sulcus intermedius posterior. Sulcus intermedius posterior. Sulcus intermedius posterior. That is external structure of spinal cord. And on this side the same, we have roots of spinal nerves joined together and formed trunk of spinal nerve. There is no space. I draw it here. From spinal cord, oh no, how many spinal nerves start from spinal cord? Somebody know? 31. Good, 31. 31 nerves. 31 nerves. And these nerves lift vertebral canal through openings. Who remember what is the name of these openings? Foramen, intervertebral, intervertebral foramen. Okay, foramen, intervertebral. And how many cervical nerves? 8. Yes. How many vertebrae? 7. 7 vertebrae. But first spinal nerve pass between skull, between occipital bone, and first cervical vertebra, between atlas and occipital bone. And another 7 nerves pass between corresponding vertebrae. Clear? Then how many thoracic nerves? 12. 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. 31 nerves. 31 nerves, and 31 nerves arise from spinal cord, and 31 segments we distinguish in spinal cord. One segment of spinal cord, that is vertical part of spinal cord with one pair of spinal nerves. Clear? 31 nerves, that is 31 segments in spinal cord. And we said that spinal cord finished at the level of lumbar 2 vertebrae. But we have 5 lumbar, 5 sacral, and 1 coccygeal vertebrae. And these nerves arise from spinal cord and descend in vertebral canal and leave vertebral canal through corresponding openings here and here, here, here. Is it clear? Yes. Come here, everybody. Come here. Is we remove arches of vertebra, and we can see vertebral canal, canalis vertebralis, and here it is spinal cord. That is place where spinal cord is finished. Here it is conus medullaris, and continuation of this conus only meninges, soft meninges, filum terminale. And here it is spinal nerves. That is cervical, thoracic, lumbar, and we can see that lumbar third, lumbar fourth, lumbar fifth, first sacral, second, third, fourth, fifth, and first coccygeal vertebrae, they descend in vertebral canal together with filum terminale. Filum terminale in central part, and laterally from it, roots of spinal nerves descend in vertebral canal. That is why if we insert needle between third and fourth lumbar vertebrae into vertebral canal, there is impossible to destroy spinal cord, but we can insert needle into the root of spinal nerve, and what we receive. No, that is not a problem. Your patient feeling like something electric shock into the knee joint, or maybe it is not so good, but it is not a large problem. There is impossible to destroy spinal cord. You not to make harm for your patient if you insert needle between fourth and fifth, and or between third and fourth lumbar vertebrae. That is not a problem if you insert into the root of spinal nerve. Problem if you destroy spinal cord. Now, last moment, look here. That is spinal cord, that is hard means duromator, and it is pia mater. And pia mater continue, look here, continue from spinal cord it is filum terminale. That is conus medullaris. And now it is filum terminale. And filum terminale here, and it is roots of spinal nerves. Which nerves? From third lumbar till first coccygeal. All of these roots descend together with filum terminale in vertebral canal and leave vertebral canal through correspond openings, foramen intervertebrale or between sacral openings, foramina sacralia pelvina or foramina sacralia dorsalia. Do you remember? Okay, that is what we can see on preparate. Here it is fissura mediana anterior on anterior surface, and behind not so clear to see, necessary to remove pyometer if you want to found groove sulcus medianus posterior. On anterior surface, more clear to see fissura mediana anterior. It's deeper than on posterior surface groove sulcus medianus posterior. That is all what you will show me next time on our next classes on Thursday. Spinal cord, filum terminale, roots of spinal nerves. It is this picture where when we can see filum terminale together with roots of spinal nerves below from the level of spinal cord has name tail of the horse. Tail of the horse. In Latin, cauda equina. Tail of the horse. Cauda equina. That is all what we can see on preparate. Take your place, we continue.
Can't stop it. Just stop it.